Good afternoon, and welcome to the National Nursing Week moderated panel presentation on substances and stigma in the helping professions. My name is Aidan Hamza, and I'm the policy lead at the Canadian Nurses Association, and I will be hosting this webinar. I would like to begin by acknowledging that this online meeting takes place across Turtle Island, the sacred land for which for thousands of years has been and continues to be home to many Indigenous peoples with whom we are honored to work in relationship. I'm speaking with you from the traditional lands of the Anishinaabe, Haudenosaunee, Lenapehoek, and Attawandaron peoples. As we commemorate the second consecutive National Nursing Week of the COVID-19 pandemic, we're also dealing with a third wave that has caused a dramatic increase in hospitalizations around the country. I know that so many of you are may be feeling demoralized from witnessing the devastating impacts of the virus is having. I want to take a moment to express how deeply grateful I am and that despite these incredibly challenging times, you continue to answer the call and provide care for those in need. Nurses in all practice settings, many in crises, have played a significant role in Canada and across the world in response to this deadly virus. We have shown the value we bring to the health system, and it is now being recognized. I've heard about many inspiring stories about the amazing, dedicated, and selfless efforts of our nursing colleagues showing up and providing expertise, knowledgeable, ethical, professional, and compassionate nursing care to individuals and families. This year, Johnson & Johnson, the world's largest and most broadly based healthcare company, has sponsored National Nursing Week to showcase its commitment to the well-being of Canada's healthcare professionals. Johnson & Johnson's strong relationships with nurses goes back over a century. As a company, Johnson & Johnson has worked to support and empower nurses and has recognized the incredible impact nurses have on patients and on the health system. The company has seen firsthand how nurse-led innovation can transform human health and has advocated on our behalf for decades. The Canadian Nurses Association is proud to partner with Johnson & Johnson to bring a voice to our nursing profession, and we are grateful for this Johnson & Johnson sponsorship for our National Nursing Week activities. I'd now like to show a video from Johnson & Johnson highlighting the important role of nursing throughout history.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread. So patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand: garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
Today, we are joined by the head of Government Affairs and Policy, Lesha Babiak. Over to you, Lesha.
Thank you very much, Aidan. I appreciate that. Good afternoon, everyone. As Aidan mentioned, my name is Lesha Babiak. I'm the head of Government Affairs and Policy for J&J here in Canada, dealing with and supporting our 6 businesses that we have here in this country. As you may, and many of you already know, J&J is a long-standing partner, the Canadian Nurses Association, and also the Canadian Nurses Foundation. and our company has been a very strong advocate for nurses for over 100 years. It is my pleasure to welcome you to this CNA abstract presentation on substances and stigma in the helping professions. Today's expert panel will delve into the work done within the Ottawa Police Services to facilitate acknowledgement of substance abuse and recovery models within the stressful field of policing and explore the implications and parallels in nursing. Together, we will have the opportunity to recognize that substance use disorders are a reality in helping professions. We will gain awareness of peer support as a recovery method in police services and uncover how stigma is a barrier for helpers, like police officers and nurses, to getting help with substance use when needed. I'm joined today by remarkable Canadians who have dedicated their careers to understanding and treating substance use disorders. Sarah Flogen will be our moderator today. Many of you know Sarah for her role as Substance Use and Addictions Program Project Lead at the Canadian Nurses Association. Sarah's experience in advocating for research, ending stigma, and knowledge exchange will serve her well in guiding what will certainly be a productive and interesting discussion today. Gord Gardner is the Executive Director of the Community Addictions Peer Support Association and Chair of Recovery Day Ottawa, an annual event aimed at reducing the stigma surrounding addiction and raising awareness about recovery. Informed by his own 38 years of active addiction and influenced by those who helped him, he is now a national public speaker, thought leader, and trainer. He is dedicated to removing barriers to enable policy writers, academics, researchers, and people with lived and living experience of substance use disorders to take evidence-based actions to improve the lives of people impacted by substance use in Canada. Welcome, Gord. Rowena Martin is Vice President of Operations and Strategies at the Canadian Centre on Substance Use and Addiction, where she provides operational leadership and direction in implementing the organization's mandate to address substance use and addiction. Her organization has been working towards a healthier Canadian society by reducing the harms of problematic substance use and is committed to fostering understanding and creating awareness of substance use issues. Welcome, Rowena. And finally, Angela Slobodien is the Acting Director of Wellness at the Ottawa Police Service. As a registered nurse, she has worked in hospitals and in public health. After completing a diploma in occupational health nursing, she joined the Ottawa Police in 2009, where her passion for health promotion and illness prevention was put to good use. She now also leads the service's health and safety team and the peer support and resiliency program. As a member of the Community Addiction Peer Support Association role, she sees the importance of reinforcing the stigma reduction language surrounding mental health and addiction within her workplace and in the community. Welcome, Angela. So Sarah, over to you.
Thank you so much, Lasha. And thank you to Johnson & Johnson for supporting us this week. Much appreciated. And to you, Aidan, for hosting us and supporting us, and to Canadian Nurses Association, Mike, for your support of this as well. Happy Nurses Week to all of the nurses there. And as you saw on the panel descriptions, some of the panelists here, Angela and Rowena, are also nurses. So thank you also for your work, and happy Nurses Week. I'm going to draw your attention to the chat for a moment. There's some instructions there around, well, first we want to let you know that we're recording this presentation today, but also we'll be taking questions and answers, providing some feedback afterwards at the end using the Q&A function. And also just in the area of housekeeping, I have some notes with me, so every so often I'll be looking over at my notes. And also there has been a little bit of internet instability I've been hearing, and a little bit of catchiness on the internet. If my camera goes off, it's really to be sure that the connection stays stable. So I'm still here behind my name if that should happen, or for any of us if we have to shut off our cameras. So just for some background, first of all, thank you, sincere thanks for being here, everyone. I really appreciate your support of this topic. Just for background, like how did we get here? How are Angela, Rowena, Gord, and I connected? and what's the work that we're doing, much of it in collaboration in different ways across our organizations. So after the legalization of cannabis in 2018, the Canadian Nurses Association conducted stakeholder consultations with nurses across Canada. We were in Montreal, Toronto, Burnaby, BC, Halifax, and Yellowknife. And we wanted to understand, what did they need to know about cannabis, because this was very new to our practice, an illegal substance previously becoming legalized. This was quite instrumental and changed our practice. And some of the things that nurses shared at that time were that they needed to know more about stigma. Nurses identified themselves that within our profession, we stigmatize people who use substances, and we stigmatize our colleagues who use substances as well. And the other thing that they raised was that they wanted to know more about nurses using substances. So this talk today is really helping to bring forward and identify and address that nursing learning need that was addressed. So then in my role as project lead, I was like, okay, so I'm not an expert in these areas. Now what do I do? And I was really fortunate to learn about CCSA. That was one of my first places that I discovered. And I was really pleased to find such evidence-based approaches, some really geniuses that are working there in the cannabis team and throughout the whole team. And in my speaking to CCSA, I said, well, I really want to know what people with lived experience have to say. Like, what do we need to know as nurses in our approaches? What should we be thinking about stigma? And that led me to Gord. And that led me to this t-shirt. So I met with Gord in person before COVID happened, and I was fortunate to go a couple of times actually. This t-shirt is actually baby blue, even though it doesn't look it. And I actually think that that's Gord helping people out. On the back, it says stigma ends with me. So I'm not going to turn around, but I just wanted to really show that this organization really is working towards ending stigma. So this collaboration then led to an understanding of the Ottawa Police Services and peer support work that was happening there. So all of this has been part of the journey of the SUOP project. So it's a pleasure to have all of us here to be able to learn more and to see where some of the common themes are that happen in the helping professions. All of us are working towards trying to provide services to the public, and yet we're also suffering. So our panel will share the details of the journey to change the culture in a stoic profession, the policing profession, but also moving to the nursing profession, and to provide access to helpers in their path to wellness. So we're going to be exploring several things. I'll give you a snapshot first, and then we're going to move to our panel. We're going to explore peer support in the police services. We're going to explore the impact of COVID currently today on our professions. We're going to explore stigma, and we're going to explore support. So some of you might want to have pen and paper on hand. There might be things we skim over that you're going to want to Google later. And some of you may want to have your phone on hand for at the end, we're going to provide a snapshot, a slide of resources. So some of you may want to be able to access those resources later. So Gord, we're going to start at the beginning. How is it that you came to work with Angela and the Ottawa Police Services?
I guess we considered stigma as a focal point of blocking access to help. And we looked around and we wanted to uncover the most hidden and most arduous stigma out there, and that's in the first responder community. So I made a presentation to the Police Services Board. They were expecting me to complain about how police were treating people who use substances, but I instead said I'm here to help because it's how you're treating your members and your colleagues and your families that I'm concerned about. And I ended up being introduced to Angela, and then, she's working in that difficult field where professionally people do not identify. And so not sure what it was like for Angela to meet me for the first time. I imagine I was waving my arms a lot and pretty excited, but I'll let her tell you that part of the story.
So Angela, to have peer support within Ottawa Police Services, means that there's open acknowledgement of problematic substance use in the field. Can you tell us about the work that was involved during this journey? This can't have happened overnight, to be able now to be having peer support in police services. I guess I'm asking you what happened after you met Gord.
Thank you, and then thank you again for having me part of this panel and being part of the Nursing Week. I'm pleased as punch to be here. The peer support program we have at Ottawa Police is not solely for substance use and substance use disorder. It's meant to be available to anyone, and our sworn and civilian members, our retirees, family members, for various.
Angela, I'm sorry, really sorry to interrupt you, but there's a comment that people can't hear you.
Okay.
Is it possible to come closer to your mic, or?
I will. I'll go off video for a second to get closer.
Okay, perfect. Thank you so much.
So is this a little better?
It is actually.
Yeah. Okay. So the peer support program we have is not just solely for substance use disorders or problematic substance use. It's meant to provide support to all kinds of challenges that our families, retirees, and members can experience, be it divorce, death of a child, trauma associated with the work they do, etc. The peer support team itself was stood up in 2018. We worked with a provider, Mental Health Innovations, to help us design our peer support team. And I think the big piece to this is for organizations, especially in nursing, that are looking at developing a peer support team, the real focus about, nothing for us without us. So really the building of that peer support team was for us, being the members of the service, and built by us. And that was key to develop a trusting environment, because that's going to be what will allow people to come forward and talk to others about their lived and living experience, whether it's substance use, mental health, whatever it might be. So that really led to a strong and early uptake of use of our peer support team. Identifying the right people with a variety of lived and living experience was also crucial in creating our 37-member peer support team. We recognize that everyone's wellness path is different as those that are on it. So with this understanding, we know that peer support is only one way we can reach out to those who are living with substance use. We know that culture change is critical, and that takes a long time. So along with peer support, the peer support team, we also look at ways to help change and contribute to a positive shift in our culture by using non-stigmatizing language, person-first language, and most of all, helping to educate others about substance use disorder. This in turn helps build a safe environment that allows an employee to step forward to ask for help. And so, that's what it's slow, steady little steps.
Thank you. You said a lot there, and we're going to be picking up the thread about person-first language later. But I also heard you mention trauma, divorce, other things there that are going on in people's lives. And we know from the ACEs work, Adverse Childhood Events Study, which is one of those things people might want to jot down to look up later. But would you say that there's something else going on in people's lives as well, or maybe not else, but that there's a context, I guess? Would you be able to speak just a little more to that?
Sure. I think, in the 25 so years I've been working in occupational health and disability management, what people come forward with initially may not be what's really behind it. So that chronic pain, that we know there's a lot of connection between PTSD and substance use. So knowing, giving people a safe space and what they identify as the issue, there's usually a lot more to unpack there. We know that with respect to when we look at EFAP and people use police with marriage challenges, what's behind that, right? So it's, recognizing, having the availability of people in your peer support team that are champions and have lived experience in a variety of ways helps to open those conversations.
Wow, thank you. That's very powerful. I really appreciate you sharing that. So before we move to stigma, we just did want to also acknowledge the very high stress levels that people are working with right now across the country, well, globally, because of stigma, because of COVID, actually. And we were going to move Rowena to you about this, because I know that there's a lot of work done around understanding the impact of COVID on substance use. And in fact, a different organization, Public Health Agency of Canada, just disseminated an infogram on this very topic. And Alicia, I'll ask you to pop that into the chat if you would. But Rowena, could you speak to us about the impact of COVID on substance use?
Sure, Sarah, thank you. And happy Nursing Week to everyone. So our organization, we've been working in partnership with the Mental Health Commission of Canada and Leger to lead an ongoing poll of more than 7,000 Canadians 16 years of age and older. So the poll examines the impact of the pandemic on alcohol and cannabis use, as well as on mental health. What we're starting to see is that our polls showing that the pandemic has been associated with an increase in alcohol and cannabis use. And specifically, we found that 30% of those who use alcohol report using more during the pandemic, and 35% who use cannabis also report using more during the pandemic. We've also found that the impact of COVID-19 on substance use varies across different populations. And what we've seen is that individuals with past or current mental health concerns are more likely to report increased use of both substances, alcohol and cannabis. Also, women living with younger children, so those less than 13 years of age, are also more likely to report increased use of both alcohol and cannabis. And lastly, the problematic alcohol and cannabis use continue to be more common in men. And with regards to the study that Sarah mentioned, so it was the Canadian Institute of Health Information as well as the Public Health Agency of Canada had released a report that had very similar findings. So the report did indicate that substance-related hospital care and deaths have increased during COVID-19. And specifically between March and September, there was an increase in both emergency department visits and hospitalizations for opioid stimulants and cannabis. The number of hospitalizations for alcohol-related harms also increased. Deaths from substance-related harm also increased both in the emergency departments and inpatient settings. And lastly, among those who use substances, men and people from lower income neighborhoods were most impacted.
Yeah, that's significant, isn't it?
Yeah.
So nurses are witnessing this in their care as people are coming to hospital or to community clinics. They're witnessing that. But Gord, I'm curious, like we've talked about the issues in the police and we've talked about the issues in the general public, but from your work, I know you have contact with every discipline and many people come to you for services. What about nurses? Would you include nurses in that? Are we having problems with substance use?
So if I can put some context to that, we often think about substance use and we often attach that to poverty and to a homeless population who are actually almost always bumping up against the healthcare system, bumping up against the community safety system. And they may be receiving the wrong services, but they're at the door. And the door in many cases is reaching out to them. But I think the most desperate person I've ever talked to was a nurse in a hospital that had a treatment center in the hospital, who told me whatever I did, no one could know that she had this trouble. When I suggested she could walk down the hall for help, she was terrified. Oh no, no one here can know. And so we're, whether it's police, whether it's paramedics, fire, nurses, we have this culture of, I think I'm going to quote Mike here, we have this culture of heroism, of these models of resilience that are just false. It's this idea that I'm someone else when I get to work. And, you're not. You can maybe shut it off, but you can't cut it out, right? You're still a person. You've got a uniform on, you got a card, you got a title, but you're a human being. And unless you have a place to manage those lifestyles, and if you can't even begin the conversation, unless it's out of that most desperate place, how do you have just a conversation about substance use without automatically going to, oh, you must have this? And if I can't have a conversation about, geez, I had a little more last week than I planned to, how am I ever going to tell anybody? I've had a little more every day for a year than I planned to. That conversation is never going to take place. So I see nurses and first responders as the most stigmatized population we have in the country, to be honest with you.
Wow. Yeah, that's something. I wasn't aware of that, actually. Yeah. You mentioned the nursing culture, and there's recent research coming out about this, actually. My colleague in BC, British Columbia, Charlotte Ross, has written a couple of papers very recently, one of which is called in the family of a 2 glass of wine shift, that nurses will joke about how stressful it is using alcohol as the key. Like, that's how stressful it is. Tonight I need 2 glasses of wine. So I hear you. It's stressful and we'll make jokes, but the fact that the nurse who came to you felt fear to go down the hall, that's a different matter. It's in that family, though. And we're really talking about stigma, and I think that's where we're going to move now, is towards stigma. And some of you have mentioned person first language. So let's talk about that. Rowena, recently, in fact, it was Gord who led the workshop, but I was fortunate to attend while we could go to things in person, and a stigma workshop actually at Ottawa Public Health. And I was very impressed with the exercises and with the focus on language. Could you tell us a little bit about person-centered language stigma training and any resources?
Sure. Perhaps to begin, I'll touch on person-first language, which as nurses we're all familiar with. So for instance, in the case of eating disorders, we would identify patients as a person with an eating disorder, not a food abuser. So same goes for substance use. So there's terms that have been made common by the media, by society, such as addict or former addict, substance abuser, drug user, relapsed, clean, alcoholic, and all of these terms are harmful and contribute to stigma. So in healthcare, we're often the first door people come to for help, and it needs to be a safe place without judgment. I'm focusing on language, but it could be a look, it could be a behavior, it could be a tone. So practicing person first language will be a culture shift for many organizations. And it'll start with embedding terms such as person with a substance use disorder, person in recovery, person with living experience, substance use recurrence. And this takes away the judgment, and it acknowledges the person. So leading into that, into the workshops, a lot these concepts are really embedded as part of the workshops. So the Stigma Workshops, we co-designed these with CAPSA, so Gord's organization, and their objective is to raise awareness about stigma towards people who use substances or have a substance use disorder. The workshops are tailored to have 3 main components. So first one being educate. Educate by presenting the research on the neuroscience of substance use and the impacts of stigma and stigmatizing language. And in order to do this, we have brought in experts from the field. We brought in Dr. John Kelly from Harvard Medical School, who presents on his research on stigma and substance use. We also brought in Dr. Kim Hellmans from the chair of neuroscience from Carleton University, and she shared a research on neurobiology of substance use. So there is a strong science foundation to it. And of course, we have Gord, and he shared his experience on the impacts of stigma and the power of person-first language. The second component of the workshop is typically contact-based learning, where people with living experience provide testimonials of hope and achieving well-being. And this is really proven to be very powerful in deepening the understanding and compassion by the participants. And the last part of the workshops is typically a discussion component where the participants will come together and work on finding practical ways to challenge stigma in their families, in their workplaces, and in their communities. And just lastly, we've also tailored workshops for specific audiences. So public health nurses, community nurses, schools of nursing. So we plan to continue this work, but not only through the workshops, but also we have learning modules on our website, primers, and other resources. And so if you go to CCSA's or CAPSA's websites, you'll find many of these.
Thank you so much. Much appreciated. And you mentioned also, I think this is a really important point. We were speaking earlier about our nervous system, and you mentioned the neurobiology and that very important work of understanding not just the substance use cycle, but also that that's who we are. We're people with a nervous system, and we're seeing, hearing things all the time, and we have to process that. And how do we soothe? That's really important. Angela, I'm going to come back to you and just ask about the lived experience of the police officers in your services, and whether stigma has been an obstacle for them, and maybe a little bit around how you worked with that.
Okay, you can hear me now?
Yep, come forward, and if you have to take the camera off,
okay.
that's okay. Thank you so much.
Okay, so absolutely. I mean, I think stigma absolutely is a barrier, an obstacle, because with police officers, especially, they, as Ward had mentioned, they think about people with substance use disorders. Those are the people they are maybe engaging with in Ottawa, down in the market, or the homeless population, right? So they don't see that for themselves. So stigma, absolutely, but I don't think that's, that's not unique to policing. It's an obstacle for most people. And I would say self-stigma is even more debilitating. In caring and helping professions like nursing and policing, we're the helpers. We're not generally the ones that need the help. And get Gord's, message story about the nurse working in a hospital with the help down the hallway, God forbid that she'd take that walk. So absolutely. There's lots of research done on stigma and self-stigma, and how your state of health influences your capacity to reach out for mental health support. You may be asked right now, would you reach out? And you'd say yes, but if you're not well, yeah, that response changes. A 2017 study showed that 40% of physicians are reluctant to seek help for mental health. So stigma is real, and we have to address the sort of the elephant in the room. And that was part of, I guess, again, looking at our peer support program, knowing that we had sort of the one kick at the can to get it right, to help people to contribute to reducing obstacles and perceived barriers for asking for help. So, it's nothing that's going to happen overnight. It's sort of a slow, steady approach. Building your champions. And I think with peer support, that's one thing that helps, building those champions around with people with lived and living experience, that it's not just a group of people that talk about substance use or mental health. It's a bunch of people. You identify those champions in your organization that are seen as leaders. And I don't ascribe to that those leaders are based on an organizational hierarchy. They're the people that people trust, right? And that trust and confidentiality of, I can go to this person and I know that, it's not my career that I'm putting on the line here, right? And certainly in my world, where I'm part of a human resources directorate, the influence that I can have on the way language is written in policies, where we're reducing that stigma that's written into policies around responses to somebody that may be coming forward with a substance use disorder, needing some help, that we're not, smacking them with a performance issue, or their career is hanging in the balance. So, all kinds of different ways that we can help impact the ability for people to feel safe to come forward, and especially in a professions that there's such huge reluctance around that.
Mm-hmm, mm-hmm. Thank you, Angela. You raised really important points around the maybe fear of the job. Yeah. So Gord, I'm going to go to you about that. Have nurses commented to you around maybe their fears of job, or what's the role of stigma for them that you've
Certainly, there's a friend who was a successful nurse up to the point of the end of her career, but was actively struggling with substances throughout that time. But that dedication and that determination to get to the shift got her through that. But, you know, at 72, finally came and sought help. And she was terrorized because there was more than, it was about, but I'm a nurse, right? And what will people think of me because I have this other piece that I think carries this image with it about who I am, you know? So it's really complex. And again, you know, I don't want to, I like to stand beside a bunch of communities, but, you know, there's a different experience with an Indigenous member of the nursing profession who struggles with substances, or a racialized member, or a woman, or a trans person, right? And so there's these exponential things as well. But a lot of it is to do with the identity. I can't need help. I'm the caregiver. And you know, talking about relationship with substances, and so we want to make sure we're not talking about temperance here. You know, most Canadians use substances, and most Canadians find some benefit from their substance use. But most Canadians don't know what would be harmful in my substance use. They don't know the difference between 2 drinks and 1 drink. They don't know the difference between, I had 5 2-drink shifts in a row, and so now I'm harming myself instead of soothing myself, right? And so without being able to have that conversation or that knowledge, and so I look at this, if you look at physical health, you don't naturally assume that I'm talking about somebody with a broken leg at the emergency department. You're talking about walking and eating and diet. But I talk about mental health, well, you know, I'm also talking about meditation and taking care of myself and wellness. You don't think I'm just talking about psychotic episodes at the hospital. But if we have this word, and addictions.
Yeah, true. Yeah.
Right. And so we block all this other conversation. So, right. And so we need to talk about substance use health, including the fact that most people are going to use substances, and we just want to be healthy about that. And so, you know, the reason people use substances, they tend to work. A glass of wine is relaxing, and it's all the muscle memory that goes with that, right? But when is it really serving me? That's the question and the understanding we need to be able to develop for people. You know, we'll have that conversation without the assumption of, oh, you know,
yeah. No, well said, and very good point around this. We're not saying, you know, no substances. We really do have a harm reduction approach, and people do use substances, and, you know, for the most part, it's really when it becomes a problem that I think we're concerned about our colleagues, they're suffering, really, not around policing them or reprimanding or judging, but really how to help. And on that,
if you looked at the adverse childhood experiences, or if you look at the precursors to substance use issues, you would say exposure to trauma, ongoing exposure to trauma. You would say access to substances, and you would say the inability to talk about your experience would be the precursors. And then you look at the first responder community and say, oh, you're all set up to have some experiences that aren't healthy around this. It's a setup. It's going to happen. It's not a failure. It's not, they didn't do the job. They didn't care. They didn't, you know, it's just, that's what's going to happen. So we need to be in a position to openly discuss when it does, is just as you described, from a place to, as we said in our posters this week to celebrate Nurses Week, we want you folks to be treated the same way you treat us. Wouldn't that be nice?
Wouldn't it be? Yeah, to have an honest view of the landscape and how we are setting ourselves up. Yeah. So on that note, there were questions that were raised to us before this panel went live around how might somebody know that they're they're struggling, like how do you know? And then also, what do you say to someone? So like maybe nurse to nurse, somebody comes to you and says something. So you mentioned the word relationship with, and that was new to me when I started the Cannabis Project. I hadn't heard terms like that, having a relationship with a substance. And I kind of had to go, oh yeah, like that's me with coffee. Like I have a relationship with coffee. I have a favorite brand. I have a gadget. I bought an espresso machine, and I learned how to use it. Like I have this whole thing going on with coffee. I talk about coffee with my friends and family. So like, it kind of was like, right, okay, so like we have relationships with substances. We have favorite wine glasses, we have decanters, we have bongs, we have like these gadgets in our home. Again, we're using substances. But how do we, and Gord, I'm going to go to you around this, like you use the word healthy. How do we know about healthy? When should we think about, oh, like maybe my relationship, with coffee, it's apparent to me, I get a tachycardia, right? Okay, like too much. And I don't like it, so I stop. But can you tell us a little bit about this?
Sure. So, I mean, if we look at, there's a whole section at the bookstore on healthy relationships. So you can sort of extract some of that, and just say, do I know who I'm with? Right. And so what do I know about the substances I'm taking? What do I know about the health impacts? And it's funny that alcohol, 18,500 odd deaths last year, doesn't have any labeling on it around its outcomes. So that means I might want to have to look at that and find out what that is. It's about, am I comfortable? If whatever I did today, could I tell you about it tomorrow, or would I feel uncomfortable? And would discomfort come from you, or would it come from inside me? Right. And so then I'm going, oh, maybe that's it. The other thing is I'm doing some planning and I'm arranging, and I know when. I'm probably thinking about my partner, my substance a little too much, right? I might be getting a little emotional dependence to that, right? If I got to check to make sure I got something, if I waiting 4 hours for that after the work drink, there's nothing wrong with an after work drink. There's something wrong if I'm waiting for it for 4 hours.
I see.
If
so is it like
potentially, right? You're beginning, if that's what's on my mind, if that becomes the thing. And then I should maybe ask myself, well, what does that give me that I really want? And what it gives me is, oh, I get to sit down, I get to mind off work. And then is that the only way to do that? Am I able to consider other ways? I don't have to do other ways, but when I can't consider other ways, I'm narrowing my experiences and developing a stronger relationship with the substance. Just worth noting. The other piece is, if someone mentions your substance use to you, you might not be happy with them, but people don't tend to mention substance use to other people without a reason. And so if you find yourself got a paragraph long to tell them why you do what you do, not instead of just I enjoy it, if there's a big story,
right?
Why is it a big story?
Right. Okay.
Right.
So Gord, I'm going to stay with you for a minute.
That makes sense to people,
Yeah.
Yeah.
So let's say this happens, because now I can imagine the audience thinking, okay, so somebody comes to me and there is this big story, and now I have this clue that, oh, okay, maybe this person is struggling a little bit, or they might need more support, and we're not wanting them to suffer. So what could somebody say peer to peer? Just you're in the med room, something comes up, or you're, at the ubiquitous water cooler, which I'm not sure we're using right now, but kind of that story, or the hallway chat, or you are out for a walk. What might you say to a colleague? What could be helpful to someone?
From our discussion today, what we've heard is that this is an incredibly fearful experience they're having. Right. So a couple things that really come to my mind is, number one, what I want to say is I want to be safe, right, to them. So not what I think is safe, but what they might think is safe. And so when I start diagnosing someone I don't know anything about, right, so the discussion that it's always interesting if I can stop and take a look at some of my behaviors over my lifetime. I found it's really helped me. My stuff. Talk about my stuff. And so I'm fortunate. I don't think anybody here today's had a perfect life. And so I'm sure there's all been some things people have had a chance to reconsider and take a look at what they're doing, whether that was even study habits at school, right? And so we can share, I was struggling one time with this, and geez, I needed to get some help. That's it. Just leave that invitation. I'm a person who struggled. I'm a person who got help. I'm a person whose life is better for having done that.
I see. So rather than saying, oh, it sounds like you're struggling with X, like maybe going to the place of, I had this issue before and I found that when I did X, Y, Z, that was really helpful for me.
Yeah.
Okay.
Yeah. It's kind of like petting wild rabbits. I mean, it's probably not the right terms, but people will be terrified if you approach them on this subject matter. Because of loss of prestige, because of job threat, because of internal stigma, right? So it's all about setting the plate. And also, I think, as Angela said earlier, having a peer support system that is trusted.
Yeah.
And is also safe to access,
So let's move to that. I'm conscious of the time. Maybe we'll do one more question around that very thing, like making the culture safe. And Rowena, I'm going to go to you for that, and then we'll go to questions and answers. What advice might you have for nurse leaders or organizations who want to start to create a safer environment for people who might be struggling?
Thanks, Sarah. That's a great question. So I think just to begin, caring is part of nursing DNA. So we go into this profession because we want to do no harm. And even more so, we want people to heal, to help them heal and be well. Stigma, for the most part, it's not intentional. We don't even realize that we're using the language that can hurt people. So we will make mistakes. And I think acknowledging it and continuing to learn is critical in terms of creating that type of culture. Maybe to my fellow nurses, I'd probably say, know the facts, educate yourself about substance use disorders. And going back to the neuroscience component, it'll explain why it's not a choice or moral failing. So just trying to shift some of those underlying thinkings. Also being aware of attitudes and behavior and your words, because your words matter and they often influence others around you. Educating others is key. So passing on the facts, using non-stigmatizing language, challenging myths and stereotypes as they occur. So that's really critical in starting to shift the thinking. Also focusing on the whole person, and we know this through holistic nursing. So substance use is only one part of a larger picture of a person. And also supporting people, meeting them where they're at, whatever stage that is, and offering support and encouragement. I think that'll be the key to help create that safe environment. For nurse leaders, what I would suggest is actually developing workplace policies that support and protect staff who may be experiencing substance use harms. We've done it for our organization. I think it'll help create the mechanism to help allow for that support and that to happen. Also ensuring adequate supports are in place, like employee assistant programs, and also encouraging their use. So not just having it there, but put the pamphlets out, posters up, make sure that they know that that's accessible. And lastly, to creating a culture, it's changing the culture. It's just making sure that your organization supports individuals with substance use disorders, whether they're patients, staff, or colleagues.
Thank you. Thank you. Very comprehensive. Thank you, Rowena. So there are a couple of questions, and some of them are touching on this very piece around feeling safe at work. But maybe we'll go in order, and we'll start with, can you comment on the impact of racism on stigma toward BIPOC who use substances? So Gord, you brought up intersectionality. I'm going to ask you to, and then Angela, I'm going to bring the work ones related to you around people feeling safe to be at work. But and then to Rowena. But Gord, will you comment on the intersectionality and racism in particular on stigma?
Sure, and I'll do that as an ally and standing beside instead of speaking in front of, if I can. I just want to identify that I'm speaking about others. And so, but I am familiar with some of the material. So if you look at the prison population in Canada, you would see the racial bias. You would see the punishment of people of color and Indigenous people is just, I think 43% of the women in federal penitentiary are Indigenous, and they represent 4% of the population. The other thing is, if you look at supervised consumption sites and you look at harm reduction services, they tend not to be designed for the racialized communities to have access to. And there's a whole different range of substances used by some communities that aren't used by other communities, and those services aren't provided. So I think not acknowledging that race is involved here, it would be unseemly. And to the depth of that, I think just takes more research and more understanding, but beginning from the place of knowing it's a true story and we need to address it.
Thank you. So we have a couple of comments from Ryan Hoekstra that nurses aren't just staying quiet because of stigma, the real consequences that follow from the college, that there's been, instead of punishment and threats around substance use, what other strategies could be used. So Angela, in your work at the Ottawa Police Services, could you comment on some of the sequelae that people may have felt, or the worry of threat and punishment, and maybe how culture can change? There's a lot there, but if you could try to take a stab at that question.
Yeah, I have to go off video again so you can hear me. Absolute good point by Ryan. That is a big piece of why people don't come forward, and policing, certainly taking their gun away, taking their duty belt away, and the identity piece is huge. So certainly understand that. And that's where the policy, Rowena spoke to this, as far as our leaders need to get behind this and recognize this, again, isn't a moral failing, it is an illness. And so I know personally, that's the messaging before we ever stood up peer support, before we ever stood up any of our sort of resiliency program, early intervention programs at Ottawa Police. It was about changing the thought around when someone is ill, take away, like, let's not divide it up of physical health, mental health. Let's just talk about their health. And so kind of putting it in that frame and being, ensuring the confidentiality of that would help some people, I believe, to come forward, because knowing that the reason why they're away, they're stepping away from their job, isn't going to be known, and that we can assist them in getting, maybe in inpatient or outpatient care and support. They're just off work because of they need help. And so, but it's absolutely real. As far as, you need to work with your unions and associations, your colleges, to help change those practices. We have to, that being said, people need to be accountable for their performance and their behaviors, right? We can't risk having people being put at risk, but knowing that people can come forward in a safe, supportive, confidential way is paramount to making a change.
Mm-hmm. Thank you, Angela. And there's one question here around policies to help nursing staff feel safe to come forward. Which policies could be changed? What types of policies? So I think that John is looking for a little bit of direction around how to advocate within the institution. Well, we have a couple of nurses here, Rowena and Angela, and myself. To me, that's about organizational. Each organization has their internal policies. There isn't like a national policy, but that would be, to me, an occupational health policy. Rowena and Angela, do you have anything? And maybe, and Gord also, people may have come to you around those sorts of changes. And then we'll have to be wrapping up. Any comments? Where should John direct his attention to facilitate change in his organization?
Give us a few more weeks. We're working on an organizational assessment tool for stigma, including reviewing policy. And so that'll be probably with our friends at CCSA and Canadian Public Health Association. So we're getting there. The other thing I just wanted to comment to Ryan, that we use the word stigma because if you run around and saying it's discrimination and oppression, Canadians don't like to think of themselves in those terms. So we say stigma, and then when people lean in to find out what we mean, then we talk about discrimination and oppression. So what you're saying there is that's the form stigma takes in the workplace, and I absolutely agree. And that goes back to that punishment model. If you're losing your job, we'll get you to stop. And of course, that's not what happens, right? And so it's well-intentioned, ill-informed, outdated policy, and I'll be quiet.
I'll just
That
add.
was really helpful, thank you. And because you said you ended with policy as well, which was John's question, back to policy. Angela and Rowena, where would you direct John?
Actually, I can touch base with John afterwards. We've done a scan of workplace policies, and to the point where distinguishing between safety sensitive and non-safety sensitive, and that's key because of so many other considerations with the safety sensitive industries. Happy to connect with John afterwards if you'd like, and we're doing more work this year as well on policies.
Thank you. And Angela?
Yeah, if I would just add to what Rowena is saying, that safety sensitive piece is so critical. I think the, looking at fitness for duty. So I was part of our cannabis policy when cannabis was legalized. And of course, policing was, kind of put on its head and all kinds of other reasons, but, that fitness for duty. So assessing for that, looking at language around that, but also recognizing that if you're in a position that fitness for duty isn't being met, that's addressed, but it's not addressed in such that we're still not caring for the individual, right? So, there may be a performance piece that needs to happen, but the care for the individual stays in place, right?
It's not punishment.
Exactly. It's viewed as, a health matter, with some performance issues maybe over it, but it's not deemed as a conduct issue. It's deemed as a health issue with some performance that needs to be addressed potentially.
Thank you to all of you. It sounds like we've touched on an issue there's a lot of work that we need to be doing yet. Looking at the culture of the profession, the policies within the profession, there's widespread. I just had today in my inbox a question around decriminalization. Like there's all of this happening as well around substances, lots of drug policy work ahead. Thank you so much. We all appreciate you taking the time out of your week to be here with us to celebrate Nursing Week and to ensure that nurses are well looked after. Thank you to our audience as well for your participation.
Thanks again to Sarah for moderating such a great discussion, and to all of the panelists for joining us and really pushing us to have this challenging conversation within the profession. And thank you to everyone who attended and for your really insightful questions. I hope you all enjoy the rest of your afternoon and have a great National Nursing Week, and that we continue to have this discussion moving forward.
Aiden?
Yes,
there's a question about whether resources can be mailed to panelists. I don't know if you can answer that immediately or before they sign off.
Yep, I think we can make the email, the resources available via email to those who signed up for the webinar presentation. So you may receive an email afterwards, and we can also post it on our website as well.
Oh, that's great. Yeah, because we have emails because people registered, correct? Too.
Absolutely. Yep.
Brilliant. Okay, I hope that helps whoever asked that question.
Is it possible?
And I'll just add my thanks to the panel. It was terrific. What a great conversation. Thank you. Thanks for moderating, Sarah.
Pleasure. Thank you so much for the courage to bring this forward, Mike.
Well, it's such a thorny topic. And anyway, you have great ideas and great comments from the people participating too, especially around the threat with the license. You know, that's such a thing in nursing, not just around substance, but even if you make a mistake, you know, that somehow you'll lose your license. It's comparatively rare, actually, but it's a very effective threat.
Yeah, it really is, isn't it? And threat is what it is. Yeah.
Yes, more stick than carrot, I think.
Yeah, that's right. Fear-based. It's a fear-based holdover. Yeah.
Please reference my work email if you. I will capture all these notes and look at them after. I'm going to sign out, and are we all done now, Aiden? Have you closed it down? I think there's still some people in the. Oh.
Yep, I think we're all done for this afternoon, unless there's any final comments. But again, really great discussion, and I think it hit a tone with many of the people who are participating today as well.
Exactly.
Thank you so much, everyone, and happy Nurses Week.
Thank you, guys. It's all nice to meet new people. Thanks for the great session.
I was the visitor today in many ways, the non-nurse. Thank you.
Take good care, Gord. Bye.